Hi everyone, and welcome to another Virtual Student Experiences Season 2 webinar. Today's webinar will focus on anesthesiology, and if you guys are new to our program, Virtual Student Experiences is a pro bono initiative spearheaded for students by students. We at Virtual Students want to be the inspiration for aspiration. Our goal is to give students around the world an opportunity to hear from professionals in their career industry of interest in a friendly and casual setting. And if you're a student that knows what you want to do in the future, we at VSC want to encourage, allow, and connect you with professionals. Through VSC, students are given the chance to decide if their career choice fits their personality, skills, and overall interests. And through VSC, you'll be given a chance to hear from a wide variety of guests from a wide variety of seniority levels. To find out more information and to sign up to be notified about other webinars, you guys can visit our website at www.virtualstudentexperiences.com. But before we get started, I just want to let you all know how this is going to work. So firstly, I'm going to be asking our guest professional, that I'll introduce in a second, a series of base knowledge questions so that you can get a good idea of who he is and what he does. And if at any time you guys have a question that you may think of, feel free to post it in the Q&A module and we'll get to it in the later part of the webinar. We highly recommend that you guys ask questions during a webinar because it's an opportunity to get an answer right here, right now, instead of reading about it later on the internet. And just real quickly introducing our VSC core team for today, we have Becket, Gabby, and Jonathan. And for our guest, we are honored to have Mr. Steve Kimatian. Dr. Kimatian's advanced knowledge of anesthesiology began with his advanced education. He first received his bachelor's degree in chemistry from Princeton University and then graduated from the University of Buffalo with his MD. He then transferred his knowledge into experience while acting as the flight surgeon for the Air Force Special Operations Command for 9 years. And when he retired from the military, Dr. Kimatian focused on anesthesiology. He has been acting as an anesthesiologist since 1996 and continues to fine-tune his skills and knowledge to this day. Thank you so much for joining us today, Doctor. We're very happy to have you.
Thanks, glad to be here.
So just to start, can you maybe tell us what anesthesiologist does and maybe where your passion for it began?
So an anesthesiologist is a physician, which means you go through medical school, you complete college, you go to medical school for 4 years, and then you do 4 more years of postgraduate training in managing the perioperative environment, so the period of time around surgeries for patients. And your job is, from a clinical standpoint, to provide hypnosis, that is, are you awake or asleep? Analgesia, do you feel pain? Amnesia, do you remember events? And muscle relaxation, can you voluntarily move your muscles, or are they relaxed in a relaxed state, to facilitate essentially a surgical assault on the individual and turn what would normally be a very traumatic event into a non-event. That is, it is not recalled, it is not felt, it is not remembered, and that the end result is a surgical correction of a problem. I have done additional training beyond the 4 years of residency. I'm fellowship trained in pediatric anesthesiology, so I specialize in taking care of children, and I have additional subspecialty expertise in congenital cardiac anesthesia, which is the treatment, the management of children with heart defects in their perioperative period. And so the role of an anesthesiologist clinically is to provide those services to the patient during the surgery. We work as team leaders with nurse anesthetists, anesthesiologist assistants, and the nursing staff in the operating room. The other role the anesthesiologist has from a systems perspective is that we run the OR environment. That is to say, as cases get scheduled, we manage the movement of resources to facilitate urgent emerging cases, putting cases into rooms, seeing the patient through the preoperative screening portion and into the postoperative acute pain management. And then there are also anesthesiologists who do subspecialty training in intensive care and work in intensive care units. And those folks have been very busy lately with COVID issues, as well as anesthesiologists who specialize in chronic pain management. And those are pain conditions that last beyond the actual insult, or pain conditions that exist in absence of an identifiable insult. And this could be a debilitating, life-changing disease that, if managed appropriately, allows someone to get back to a normal life. So those are the major sort of areas where anesthesiologists function in.
Awesome. And then can you maybe speak to where your passion for that began?
So my passion for that came through my military experience. So as a I was chief of aerospace medicine for Air Force Special Operations Command, as you pointed out. And I spent a lot of time out in the field. And this is in the 90s and early 2000s. So we're talking about events that probably aren't part of your history, but the original Desert One liberation of Kuwait, Bosnia, the Bosnian conflicts, Mogadishu, Somalia, etc. And part of my job was to manage and triage injured soldiers. And at that time, I had completed my medical training, but I had not done any subspecialty training yet. And I was debating between three areas that I had interest in. I had interest in family practice, I had interest in emergency medicine, and I had interest in anesthesiology. And what I found was that the things that made the most difference in resuscitating these soldiers and getting them home successfully was being able to manage their airways, control their physiology, get access and resuscitate them, and manage their pain and control their physiologic response to pain until I can get them back behind into a safe area. And so really those were the skill sets, not of the emergency medicine physician, which is what I thought they were originally, but really they were the skill sets of the anesthesiologist. The other aspect of it that appealed to me was, as a pilot for 30 plus years, anesthesia is a lot like flying a plane. There's an interface with technology. There is a planning phase of it that makes a huge difference in your outcome. And as both pilots and anesthesiologists are fond of saying, it's hours of boredom punctuated by moments of terror. When everything's going well, things run smoothly, it almost looks effortless, people forget why you're there. And when things go bad, that's when you really earn your keep and you make a difference in someone's life.
Awesome. And then were there any special steps or special requirements that you had to meet before becoming an anesthesiologist?
You broke up there. Could you repeat the question?
Oh, yeah. Were there any special steps or requirements that you had to meet before becoming an anesthesiologist?
So going into anesthesia training requires obviously successfully completing medical school. And then for residency training of any type, it's a competitive selection process. So you have to interview for, apply for, and then get accepted into an anesthesia program. And right now, anesthesia is one of the more competitive specialties to get into. Requires higher scores on what are called your USMLEs, which are your your postgraduate training exams from medical school. For me, it was because I had taken that detour and went on active duty between medical school and residency. The application process was a little different because I was coming out as an experienced physician with some leadership skills, et cetera, that sort of separated me from other candidates. But the interview process and what they call the match, which is it's actually an electronic process where you go through all of your interviews, that you make a list of places you like, and the hospitals make a list of people they would like to have, and the computer puts those two things together. That process is it's a fairly rigorous process, and depending on the specialty, it can be a little bit of a challenge to get through.
And then can you speak to maybe the importance of going to a name school or really getting good grades?
Yeah, that's a great question because the old school thought that you go to the name school all the way through and that guarantees you success is not nearly as important. It may open a door for you as you go from one place to another, but you certainly have to earn your keep when you get there regardless. The other aspect of it is that when you're coming from a higher powered university, when you're applying for medical school, you're coming out of a medical school applying for residency, if you want to go to the best place that's next on that list, there are a whole bunch of people from that school who want to do the same thing. So if you're not going to be, top of the class, then your odds are almost hurt in that, coming from the middle of the class at Harvard you're better off coming from the top of the class at University of Michigan or Penn State, right? And so I think part of that speaks to where you see yourself academically as an individual, what other things you bring to the table that are going to separate you from those other candidates. But I would make the argument that the name is not as potent a magic as it used to be in terms of getting where you want to go. There are a lot of very strong candidates who, especially in today's environment with degrees costing what they are, who go to 2 years of local community college and then transfer into the name school later on. or go to the state college for their undergraduate degree and then pursue their doctorate at the higher end degree, because and then they're coming from the top of that university, and now you're a pick that might be, so if you go to, say, you know, UT San Antonio or something like that, I'm down in Texas, and then you're applying for an MBA or a medical degree in the Northeast, right? And you're at the top of that class, you have a much better chance than coming from the middle of the class from Princeton or Harvard or any of those Northeast schools, because they've got plenty of candidates from those schools who want to go there, but they may not have a lot of candidates from the Southwest who want to go there. So you become part of their diversity pick, right? So you have to be strategic about that. And so it's a great question. Name isn't everything. It really depends on strategically how you're going to position yourself for the next step.
And then for students in college and high school, are there any maybe specific classes that you recommend they take?
So for anesthesiology in particular, it's a lot of math. So it's, you know, because you're calculating drug doses constantly. So if you don't like math, algebra may not be a good fit for you. It's engineering. It's pumps in the form of ventilators. It's pumps in the form of medication delivery systems. It's airflow, gas mixing. So it's a lot of almost mechanical engineering, fluid dynamics. Those type of things are all part and parcel to the things I think about every day is in providing medical care. So as an anesthesiologist, those things really help out. If you wanted to be an orthopedic surgeon, then, you know, take up carpentry as a hobby, because you need to be good with a saw and a drill and a, you know, so it's one of those specialties. Anesthesia does require a little bit more of a STEM mindset and a little bit of an engineering background. You'll find anesthesiologists, there are a lot of anesthesiologists who are pilots, a lot of anesthesiologists who are biomedical engineers, because you have to, you got to be a tinkerer. You've got to try something and see if it works and move to something else, because not everyone's going to respond to everything the same way.
And then are there any like organizations that help to provide high school students or even college students with opportunities relating to anesthesiology?
So the American Society of Anesthesiologists is one place, and they have a very active medical student organization and group, and they do some outreach at college level. High school level, not sure if there are as many of opportunities. I know that we have had high school students who have come through and done, you know, week-long mini mentorship projects with us, and that's usually arranged through their school. But if you reach out to even the academic anesthesiology departments in your area and say, I'm a, you know, high school junior or senior interested in medicine, I'd like to come spend a week and see the operating room. It's a great opportunity to not only see what the anesthesiologist does, but you'll be able to sit in a lot of different operating rooms and see what the neurosurgeon does, and see what the orthopedic surgeon does, and see what the cardiac surgeon does. And so it would give you some insight, and also let you know if you can do all right with the sight of blood. So we've had plenty of students come in who've ended up sitting on the floor in the corner. So it's worth doing.
And then focusing a little bit more on your experiences, can you talk about your experience at Cleveland Clinic?
So at the clinic, I was recruited to the clinic from Penn State, and where I was the chief of pediatric anesthesia there, and did probably 3 or 4 days a week of pediatric cardiac work, and then 2 days a week of leadership role in terms of managing that group and running that group. And the Cleveland Clinic has a small pediatric group. It's only about a dozen anesthesiologists. And they do somewhere in the order of about 10 or 12,000 cases a year. So it's on the smaller side in terms of group size. And it's somewhat different than the position I'm in now here at Dallas Children's, where I have over 60 physicians, another 100 nurse practitioners, and we're doing 45,000 pediatric cases a year. So it's a different model, different leadership model. But in those cases, leveraged my military training a great deal in terms of organizational leadership skills, managing crisis modes and things like that.
Yeah, sorry you glitched a little bit there, but I'm just moving on to the next question. Maybe can you tell us a little bit about your current role at the Children's Medical Center of Dallas?
So Children's Medical Center of Dallas, I hold basically three positions because of the way the university sits relative to UT Southwestern, which is our medical school and our training programs, and then Children's Hospital, which is a separate entity. I am the president and CEO of Anesthesiologists for Children's, which is this group of anesthesiologists and nurse anesthetists and anesthesiology assistants who provide care across the Dallas-Fort Worth area. We cover about probably 20 plus hospitals, surgery centers. We have teams all around the city at any given time. And then as in that role as the president of AFC, I also hold the position as professor of anesthesia and vice chair for pediatric anesthesiology for the Department of Anesthesia and Pain Medicine at UT Southwestern, which gives me some teaching responsibilities. And I am the anesthesiologist in chief for Children's Health System, which means that I oversee all sedation services by anesthesiologists and non-anesthesiologists. Anyone who sedates a patient inside the system, in essence, is credentialed by my office to do that. And that's the Joint Commission, which governs hospital management, specifies that the chair of anesthesia has to look over all those things. So we basically do a lot of policy management now. I do get to spend some time in the operating room. Today was an OR day for me. But most of my time now is behind a desk dealing with policy and protocol and things like that.
And then can you speak to, I mean, you obviously have so many different years of experience in many different areas, but how do you continue to make progress through all of your years of work?
You have to find a passion for it. You have to really enjoy what you're doing, right? I mean, there are plenty of people who end up in medicine because someone told them they were going to be a doctor, or their mom or dad was a doctor, or, and then they get there and it becomes a job. And I will tell you that they say that the latest statistic I saw was about 20% of physicians change specialty in the middle of their training. So they start thinking they're going to do one thing and they switch roles to another thing. Which means that for every person who actually has the guts to make that change and set themselves back a few years, there are probably 2 or 3 people who just say, well, I've come this far, I'm just going to finish what I'm doing now and punch a clock, right? And that those people become evident very quickly in terms of the quality of the work they produce and their commitment to their patients. The same can be true. I mean, we've seen, you look at schools like Stanford, where a large portion of the class never goes on to practice medicine. They go into entrepreneurial business type things right off the bat, which I'm not sure if I would have spent all that time in medical school and not practiced at all, but some of these folks have made that choice. But I will tell you that to do this job well and to excel in this business, and this is true of almost any medical specialty, it's a 24/7 job. My phone is always on. I'm always available if there's a problem at the hospital or there's a surgeon who needs something. My family understands that. I build a lot of my off time is never truly my off time. If I am going to be out of reach completely, I need to make sure that there are backup plans in place to cover that. It's a responsibility out to my patients and to the hospital. And so that's a different level of commitment. I mean, it's one thing to say, so if you really are committed to things outside of work, you have if your work is there to support something else, you have a passion for travel, or you have a passion for this or that, medicine may not be the right career because it's not a place to go and collect money so that you can go do other stuff. It really becomes a truly encompassing and becomes a lifestyle. It's not just a job. And you see that in a lot of physicians who retire and have nothing to do because they've never really developed hobbies over the years because their hobby was their practice of medicine. And you have to maintain a lot of intellectual curiosity. I will tell you right now that of the machines and drugs that I used when I first started practicing, almost all of them are gone now. And I had to adopt new drugs and new machines and new ways of monitoring patients. And unless you keep that intellectual curiosity, you will quickly be frustrated and dissatisfied with your practice. And you have to have a willingness as a physician to deal with a lot of the administrative and paperwork for the job. I spend a lot of time dealing with insurance companies and contracts and things like that. Whereas my nurse practitioners and my AAs and my PAs, they get the joy of just seeing patients all the time. And so if you really just enjoy seeing patients and you just want to take care of people and you don't want the hassles of managing the office, going to PA school or going to getting an advanced nursing degree may be a pathway that would be much more satisfying and in all honesty shorter. You may not end up making the same salary, but you'll start making money 10 years earlier. And so in terms of a retirement plan, you're probably ahead of the game if just because you've indexed. I mean, as a physician, you won't make a real salary until you're somewhere in your mid-30s, if you think about it that way. And by then you're paying off a great deal of debt at the same time. So you really have to want to do the job. There's no fringe benefit to making a lot of money or something like that. It all goes away.
And then focusing on the skills portion of your job, can you maybe speak to maybe the top 3 skills that you use in your job?
So anesthesia is interesting in that it is it's as I mentioned, a lot of math, a lot of science, a lot of physics in terms of the cognitive aspect of it. But the really fun part of it for me is, especially as a pediatric anesthesiologist, is the fact that I have some of the smallest patients in the hospital. And we're talking, 1.5 kilo baby fits literally in the palm of your hand. And yet you have to figure out how to cannulate veins and how to put in a breathing tube and how to do procedures on these small children and infants. And we bring a lot of technology to bear. We use ultrasound to do nerve blocks and to cannulate veins and arteries. We use fiber optic laryngoscopes with video laryngoscopes to look down into airways and do bronchoscopies. And so there's a lot of hand-eye coordination. If you're a gamer, anesthesia is good for you. I mean, it's a lot of the same skill sets. You have to be able to be moving your hands over here and looking over at a monitor over here and getting things to come together as you're doing ultrasound guided procedures. So it's also a technical sport. It's one of the things that drew me to it as well. Unlike I think some of the medical specialties where it's more cognitive and you do an exam, but it's not as technical. There's a large technical component to being an anesthesiologist, very similar to surgery.
And then for students developing, interested in going into the field of anesthesiology, maybe what are some skills that they should start to develop?
I think there's as I mentioned before, I mean, the physics and the math are all important parts of understanding things. Physiology is a topic that you really have to be willing to delve into in great depth as an anesthesiologist. So if you have the opportunity to take some physiology courses, that would be very helpful. And then I think that the other part of it is, pharmacology, big part of what we do. So understanding drug receptors and drug mechanisms and things like that. There are opportunities to take AP chemistry courses. I was a chemist in undergrad, and so a lot of the work that I did as a chemist, my senior thesis and subsequent to that, when I worked for DuPont between medical school and college, on designing synthetic drugs comes into play now. So I think math, chemistry, physics, all those APs would be very helpful for a high school student who's interested in going toward anesthesiology.
Awesome. And then maybe can you speak to what a typical day looked like for you before the coronavirus pandemic and then how it's changed to now?
Yeah, so I usually get up around 4:45 in the morning. I get into the office by 6:15. I start my day by reviewing my cases for the day, taking care of paperwork from the night before. I'm in the operating room by 7:30 for my first case. If it's a cardiac case, it may be one case that goes from 7:30 to 1, 2 o'clock in the afternoon. But on a day like today, I did 6 dental cases over the course of the day. That's the nice thing about anesthesia. One day I'm doing tonsils, ear tubes. Next day I'm doing dentistry. Next day I'm doing a cardiac bypass case. So there's a lot of diversity in that. But my clinical day usually will finish up sometime around 3 o'clock in the afternoon or so. I've got, in my administrative role, I've got 3 or 4 hours of meetings like this and paperwork and things to track, emails to answer, fires to put out. I get home around 5:30, try to go to the gym or do something like that. Get home, have dinner around 7, go to bed, start the whole thing again. So.
And then just last question from us here at VSC. Maybe what are some suggestions for aspiring anesthesiologists?
I think in terms of, there aren't a lot of aspiring anesthesiologists. I'm always shy. I'm always surprised to meet people who go, oh, I've always wanted to be an anesthesiologist since I was a kid. That means either A, one of their parents was an anesthesiologist, or a close family friend or relative was an anesthesiologist, because most people don't know what an anesthesiologist does unless they've either they know one, or they've had a surgery, right? Or they've had a lot of surgeries, because usually the kids who have a lot of surgeries come to appreciate their anesthesiologists, because we help make these traumatic events non-events. And so if we do our job well, they don't remember anything. And if we do our job poorly, they have a bad day. But from that perspective, I think it's, one, make sure you have a passion for what you're doing. And, I can think of no better way to spend I can honestly tell people, there's no better way for me to spend my day than taking care of sick kids and helping make life-changing traumatic events non-events for them, right? I mean, that's it's worth getting up early for. It's worth going to bed late for. I could not be satisfied if I was going and managing somebody's money, or and balancing their stocks for them. I would never be able to put in these hours and do this type of work for that matter. So, but I think the hurdle is medical school, and to keep an open mind, because most people come into medical school thinking they're going to do something, and they end up doing something else. There's very few people, and that's what the third year and fourth year of medical school are for, is for you to rotate through all the specialties and get a feel for where your passions lie, and to really identify the patients that you want to stay up late for and wake up early for. I mean, and that's when you know that you're where you need to be. And certainly, if you have the opportunity to take a pause between medical school, internship, and residency, and go to public service somewhere, either in the military or in public health service, I highly recommend that. That was basically, it turned out to be 13 years, 6 years active duty and 7 years reserves by the time I was done with that. But it was an invaluable experience, and it really positioned me to do what I'm doing now. And I came back to medicine after my time out in the field with a completely different perspective on why I was there, what I was doing it for, and what I wanted to accomplish out of it. So I highly recommend that taking that hiatus to serve is highly valuable, whether you do that between college and medical school, or you do that between medical school and residency training. It's nice to decompress. Some of my best physicians are the ones who took a different path, who didn't go straight through school. I think some of my most frustrated physicians are the ones who went directly from high school to college to medical school to residency to work. They've basically been in school at that point 20 plus years. They're finally getting a real job, and they're realizing that they really haven't done anything of substance at that point, and so it's a frustrating place to be, I think.
Yeah, I mean, thank you so much for answering our questions here at VSC. Now we're going to switch into the student questions. So students, if you guys have any questions, feel free to ask it through the Q&A module. But I see we have a couple here. I'll just start with the first one. Are there any stereotypes about anesthesiologists or medical practitioners that aren't true?
I don't think it's a stereotype as much as, there's the thing about an anesthesiologist is that if you do a good job, nobody knows you're there. The patients won't remember you're there. You really are, if you do your job well, no one knows you were there. There's a lot like, coming out of the special operations community in the military. If we did our job well, we went in, we did something, we came out, nobody knew we were ever there, right? And no one pats you on the back and says, great job at the end of the day for that. And you have to be satisfied with it. You have to have satisfaction in that personal knowledge that you accomplished something, right? If you screw up, everybody knows. Because if you screw up as an anesthesiologist, someone's going to have an episode of anoxic brain injury, or they're going to die, and that's problematic, right? I mean, everyone will know when you screw up, and so there is the stereotype that sometimes, well, I don't know what the anesthesiologist does. You know, I come in, a lot of the surgeons will say, well, I don't know what my anesthesiologist does, but you know, I come in, the patient's asleep, and they leave, and they wake up, and that means they have a great anesthesiologist, because you know, they're not running into problems. They're doing their job, which is to be essentially invisible.
And then I think this is the last question from the students. What do you like most about your job, and what do you like the least?
So, you know, because I went into a pediatric subspecialty, I think one of the most satisfying aspects of this is my patients, they drew a bad straw, right? They either got a bad gene somewhere, they had a defect that something that didn't go right somewhere along the line, or they were adversely impacted by some adult's poor choice, okay? Or they were just being a kid. You know, if you break a leg because you want to see if you can fly off the top of your garage using a cardboard box that you built like a wing or something. I mean, that, you know, it's innocence, okay? And it's one of the reasons why I shifted over to the pediatric side. One of my frustrations when I started practicing and we're taking care of adults was that a lot of adult disease is self-inflicted. It is either a lifestyle choice or a dietary choice or even an impulsive choice, whether it's, you know, getting into an accident because you're speeding or getting into a bar fight. You end up in the hospital and you know, working at a trauma center, you see the worst of what people will do to themselves and to each other. And that frustrated me. And that was one of the reasons why one of the reasons why I switched to pediatrics and specialized in pediatrics. So I was going to be up in the middle of the night. I wanted to be up with someone who really just drew a bad straw and someone who I could help. I didn't want to be a facilitator of poor habits.
I mean, yeah, thank you so much for taking your time out of your really busy schedule to talk with us here at VSC, share your experiences, your tips, and really your knowledge. I'm sure the students who will view this later will really benefit from what you've been able to share with us here today, and we really appreciate it. For students, and for students, if you guys are interested in learning more about our program, you guys can visit our website at www.virtualstudentexperiences.com. And then, once again, thank you very much for joining us today, Dr.
Thanks again. Thanks for your time. Take care.
Awesome. Have a nice day.